Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The Richmond Agitation-Sedation scale assesses the level of consciousness and agitation in patients, particularly those in intensive care units. It measures a range from deep sedation to extreme agitation. The scale evaluates a patient's response to verbal and physical stimuli, providing a standardized method to quantify sedation depth and agitation severity. Its main purpose is to guide sedation management and optimize patient comfort while minimizing complications related to over-sedation or agitation. The use of this tool supports the prevention of delirium, facilitates mechanical ventilation, and improves overall patient outcomes in critical care settings. The Richmond Agitation-Sedation scale is indicated for critically ill adult patients who require sedation assessment in intensive care units. It is most useful in monitoring sedation levels in patients receiving mechanical ventilation. The scale aids in differentiating levels of agitation and sedation, facilitating appropriate titration of sedative and analgesic medications. It has also demonstrated reliability in assessing sedation in non-intubated patients undergoing procedures or experiencing acute delirium. Its application supports improved sedation management, reduction of over-sedation, and prevention of adverse events in critically ill populations. The Richmond Agitation-Sedation scale consists of 10 items that assess patient levels of consciousness, ranging from combative to unarousable. The examiner begins by observing the patient's behavior without stimulation to identify if they are alert and calm, restless, or agitated. If no response is noted, the examiner proceeds to provide verbal stimuli, such as calling the patient's name or speaking loudly. Should further assessment be required, physical stimulation such as light shaking or a gentle shoulder shake is applied. Each item on the scale corresponds to a specific score ranging from -5 to +4. Negative scores indicate varying depths of sedation, 0 denotes an alert and calm state, and positive scores signify increasing levels of agitation. The response format is ordinal, with each score reflecting distinct clinical descriptors. Interpretation of results follows standard reference ranges. Scores from -5 to -1 suggest sedation levels, with -5 indicating unarousable status. A score of 0 represents an optimal state of alertness and calmness. Scores from +1 to +4 indicate increasing agitation and potential risk for harm or treatment complications. The scale aids clinicians in titrating sedation and monitoring acute changes in mental status in critically ill patients. The Richmond Agitation-Sedation scale demonstrates a sensitivity ranging from approximately 80 to 90% in detecting agitation and sedation levels in critically ill patients. Specificity values reported in clinical studies typically range from 75 to 85%, depending on the patient population and reference standards used. Sensitivity refers to the ability of the scale to correctly identify patients who are truly agitated or sedated, minimizing false negatives. Specificity denotes the scale's capacity to correctly classify patients who are not agitated or sedated, thereby reducing false positives. For example, a sensitivity of 85% indicates that 85 out of 100 patients with actual agitation would be correctly identified by the scale. Conversely, a specificity of 80% implies that 80 out of 100 patients without agitation would be accurately recognized as non-agitated by the assessment tool. This balance between sensitivity and specificity is critical in clinical settings to ensure appropriate management of sedation and agitation without over or under treatment. The Richmond Agitation-Sedation Scale was developed in 2003 by Sessler and colleagues at the University of Richmond Medical Center to provide a standardized method for assessing agitation and sedation levels in critically ill patients. Validation studies have demonstrated high inter-rater reliability, with kappa statistics ranging from 0.75 to 0.95, indicating excellent agreement among healthcare professionals. Further research has correlated Richmond Agitation-Sedation Scale scores with established sedation measures such as the Ramsey Scale and Motor Activity Assessment Scales, supporting its criterion validity. Its sensitivity and specificity for detecting levels of sedation and agitation have been reported to exceed 85% in various intensive care unit populations. Additionally, the scale has been validated across diverse patient groups, including those receiving mechanical ventilation, further confirming its broad applicability. The Richmond Agitation-Sedation Scale's reliability and validity have been reinforced through multiple prospective studies, making it a widely accepted tool in clinical practice for monitoring sedation depth and agitation severity. Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.